The American Heart Association has changed its BP guidelines for the first time since 2017. Now, it recommends them for young adults because the risk goes up in your 20s and 30s. The American Heart Association, AHA, along with the American College of Cardiology and other groups, has released the latest set of guidelines that are especially important for young adults in their 20s and 30s, as heart risks increase earlier than many people expect. The new recommendations focus on, especially for those young adults who think they don't need to worry yet. Since the new approach focuses on spotting risks early, measuring health over 10 to 30 years, it also starts treatment plans sooner if needed. With tools like the Prevent calculator that predict long-term heart and brain health risks, as well as clear guidance on diet, exercise, and medicine, the goal is to stop problems before they even start. Let's find out what's changed and dive deep into how young people can protect their heart and brain health and what simple steps they can take to keep their hearts young and healthy. What's new? For the first time since 2017, the AHA and ACC have released new guidelines for high blood pressure, expanding prevention and treatment strategies for adults. But what's new in the guidelines after 8 years? Now, almost half of adults in America have high BP, 130/80 millisym Hg, making it the top preventable risk factor for heart attack, stroke, kidney disease, and even dementia. So, in the new guidelines, while BP categories remain the same, normal, 120/80ths, elevated, 120/129/80, Stage 1, 130/139/80ths, 89, Stage 2, 140/90. The updated guidelines emphasize earlier intervention with lifestyle changes and, if needed, medication. Why does this matter for young adults? The 2025 guideline is more than just an update. It shows a new way of thinking: prevent early, act early. It's based on scientific proof, puts brain and heart health first at all ages, and makes care personal using tools like Prevent. Young adults, even in their 20s or 30s, can benefit from these updated guidelines. How? Years of data show that an early rise in BP, even if the risk is low in the short term, leads to more heart problems in the long run. That's why the new guidelines go beyond a one-size-fits-all BP chart and use the Prevent trademark calculator, a tool that estimates your 10 to 30-year heart disease risk based on your BP, cholesterol, kidney, and metabolic health. In the next video, we will learn about 1. Lifestyle changes and early treatment. 2. Medication and monitoring. 3. The Prevent calculator.